Bosongoa is located north of the capital city Bongi. During the hostilities, this woman was one of many to escape into the forest. The rebels looted and torched her home. When she returned, she needed to resume her HIV treatment, but the hospital had also been looted and there were no antiretroviral drugs left.
Many people in the village are in the same situation as me. They're at home without treatment and some already died.
Bosongoa now finds itself without even the most basic health care, so MSF has opened a project to provide medical consultations to its inhabitants. The teams also regularly go into the bush where people are still hiding. The doctor's biggest concerns are malaria, diarrheal diseases, malnutrition and sexual violence. Observing the risks to the population caused by the lack of antiretroviral drugs, the teams are also providing HIV treatments.
When you go home, you need to take these drugs. This treatment is for 2 months, and when they're finished, you have to come back to the hospital.
These emergency measures will soon be insufficient. The country has been living in persistent crisis for several decades, and the instability created by the March 2013 coup has made the situation even worse. The conflict raging in Syria is escalating, and the war-wounded are not the only ones in need of medical assistance. Despite extreme violence and security risks, MSF health structures set up inside the country are trying to respond to the people's medical needs.
Due to all the latest clashes, on the war here in this area, a lot of people of the population around are going up to north. Trying to go to Turkey, or at least staying in the border here on the Syrian side. A lot of people, of course, are staying, in their own towns and villages in the middle of the fighting, the villages that are bombed by planes or shelled by artillery.
This hospital, located in the north of the country, treats people suffering from chronic illness and women needing obstetric care, the kind of medical assistance that's been sorely neglected since the beginning of the war. The MSF team also assists 7,500 people living in this transit camp near the Turkish border. They distribute basic necessities and set up water and wastewater systems. To prevent a measles epidemic, vaccination campaigns have been set up in the north of the country. More than 75,000 children have been vaccinated. This clinic at Al Ghumari Hospital is the only place in the Yemeni capital to provide antiretroviral drugs for patients living with HIV/AIDS. The reticence of medical workers complicates access to treatment. Prejudice, lack of knowledge of the disease. At Al Ghumari too, the medical personnel needed convincing.
In the beginning, they refused to admit patients in the wards. They refused to see the patient. Now we try, and we tried. We began with courses for doctors and for nurses. We feel that it is lower bit and improved a little bit, but it is still, there is discrimination and stigma in the hospitals, community and family members of the patient.
At the beginning of 2013, MSF decided to work with the national programme and local associations to support them in their work. The purpose is to raise awareness about the disease, combat stigma and improve access to treatment. Women living with HIV/AIDS are particularly vulnerable. Offering them improved screening and greater support are two of the priorities here.
The current treatment, I think.
Treatment for a person with sleeping sickness could well fit into this little box. If its efficacy is proved, 2 to 3 fexinidazole tablets a day for 10 days would be a huge improvement on current treatment options. The original treatment, an arsenic derivative, was dangerous, even deadly. The current standard treatment, NECT, is clearly better, but it combines tablets and a drip, making it difficult to supply and administer in remote areas of the DRC where the majority of patients suffering from the disease live. NECT calls for 10 kilos of treatment per patient. Fexinidazole, just a few grams.
We wanted a simple treatment, one to be taken orally, if possible for a short period of time, and not requiring any sophisticated additional examinations, so that it can be used in the villages.
Simplified diagnosis and treatment administration are essential to eradicating sleeping sickness. They are the only way to provide treatment to all those with the disease and thus prevent tsetse flies from spreading the parasite. If the clinical trial proves conclusive, fexinidazole, a real tool in the fight against the disease, should be registered within the next 2 years, and sleeping sickness could be eradicated around 2020.